Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, I am Nazirah Abdul Mumin. On behalf of my team, I will be presenting our innovation idea titled The Humanity Triad, the amalgamation of Malaysia Madani in a patient-centered care and Naqli-Aqli knowledge curriculum. We are a team of academicians from the Faculty of Dentistry, University Science Islam Malaysia, USIM. As an introduction, in a dental faculty, students and their patients are central to a dental curriculum. In other words, they are the biggest stakeholder. The current dental curriculum in Faculty of Dentistry USIM is a combination of two main approaches that are integration of Naqli and Aqli knowledge and patient-centered care approach. The concept of Malaysia Madani, as introduced by the 10th Prime Minister of Malaysia, emphasizes humanity and good values like fair, just and effective governance. It is a humane concept that prioritizes the needs of people. We propose that the concept of Madani is incorporated into the current dental curriculum in Faculty of Dentistry USIM by including the elements of humanity, creating the humanity triad. The present curriculum emphasizes normative needs as determined by the dental practitioner in the assessment of oral health care. Although patients are consulted in the assessment, the decision invariably rests on clinical measures and indices. The inclusion of Malaysia Madani shifts the perspective in assessment from a wholly normative to a collaborative approach that combines normative needs with patients' perceived needs. Both clinical and oral health related quality of life measure, which is patient-oriented, are adopted in the assessment of need and outcome of care. The humanity triad consists of three main components. First, patient-centered care, which is an approach that emphasizes respect to patient as a person and acknowledge their preferences and values. Basically, patients are involved in decision-making about managing their own health. Second is integration of Naqli and Aqli knowledge, which is an approach to education that focuses on both rational and revealed knowledge. The third is Madani, a concept that focuses on inclusivity and fairness. There are four main elements of humanity in the humanity triad. First is humanism, a belief that people have innate potential which enable them to recognize and develop their strengths and ability. In the clinical aspect, students are taught that the focus should be on the patient as a person and not merely a case. The second is humanistic. It is an approach involving interaction with other people while acknowledging that people have feelings and should be treated with dignity, respect, and compassion. In terms of clinical setting, students should ensure that each patient has a right to getting appropriate treatment that are tailored according to their need. The third is humility, which is characteristic of a man that is devoid of pride or arrogance. In the clinical setting, students should possess humility, characterized by being humble and modest. They are taught to be empathetic and sympathetic to people in need and not only thinking of themselves. Lastly, humane. It is defined as quality of human behavior that is kind, caring and considerate to the struggle of others. In the clinic, students are taught to treat patients as how they want themselves to be treated and provide treatment and perform procedures as humanely as possible. As for the usefulness, this framework can be applied and adopted to all curricula that emphasize people as the central resource. Apart from that, by adopting the humanity triad framework, the educational program may be propelled and steered to be more human-centered. As for the novelty, this is a unique curriculum where three synergistic approaches are amalgamated that are the concept of Madani, the Naqli-Aqli integration, and patient-centered care. Via this framework, we can ensure that the effective component of the outcome-based education can be further strengthened, driven by the four elements of humanity. Not only that, this framework promotes autonomy or self-governing in the students' learning and patient management and care. The outcome would be enhanced client satisfaction both in the students and patients. As for the commercialization potential, this curriculum focuses on people, the students, their patients, and all those involved in the program to promote the human side of quality. The process of implementation integrates the principles inherent in Naqli-Aqli knowledge and patient-centered care and Madani. This proposed framework can be adapted to other curricula or applied in other faculties for enhancing the potential of students and building a future generation with a strong sense of humanity. These are our references, and we thank you for the kind attention.